everybody. My topic is critical appraisals in HIV research, and I wrote it because most HIV patients in third world countries are not getting the care they need to have a quality of life, and so my research centered around how to find the best interventions for these people. Okay. Critical appraisal is an important decision-making skill that clinical researchers use to compare published findings of head-to-head studies and to compare results of systematic reviews in order to do meta-analysis of RCTs. Clinical trials have only three possible outcomes. The trial may be biased, the trial may have a small sample size that makes the result unreliable, and the trial may be correct. The lungs is the organ that HIV most frequently infects, and respiratory complications are a common cause of death. Whenever researchers need to know which is the better of two possible interventions for patients, they may implement critical appraisal skills to make evidence-based informed decisions. Here, two examples of critical appraisals are presented. One is to find which antibiotic is best for HIV patients with pneumonia, and two, the other is to find the most cost-effective NRT smoking cessation program to recommend to the HIV patients that need to stop smoking. Now I will introduce the problem. According to the World Health Organization, daily deaths from respiratory infections and HIV/AIDS are higher than that of other infectious diseases and are mainly poverty-related. Because of this, critical analysis of applications, clinical analysis of Africans' head-to-head studies may need to be done to find cost-effective therapies and lifestyle changes that may help poverty-stricken HIV patients to have a better quality of life. This is the chart I got from World Health Organization. It shows that the number of daily deaths from respiratory infections and HIV is higher than any other disease, and that they're all poverty-related. This presentation is a critical appraisal of two clinical trial reports upon which the evidence statements are based. And you can see the research papers by Cordero, and the other one is by Silago. Now, the reason why it's so important that people who have this disease get rid of smoking habit is because whenever a person has this disease, they are vulnerable to respiratory infections, and because of enzyme induction concerns, which will affect how much medicine they can take without damaging their liver even further. Now, because they're poor, they need also to get cost-effective smoking cessation programs to help them to prolong their life or make it a better quality of life. The summary of my method is I search for antibiotics for HIV patients, meta-analysis of these antibiotics, and also of smoking cessation programs. And I research how the critical appraisal skills are done, and read upon all kinds of related studies. Okay, here we have the evidence statements, which basically they're all positive, except for one where it was not able to be blinded, which is HIV pneumonia cases. They were not able to be blinded, because you know that they all have pneumonia. So that's the evidence statements, all positive, all positive, all positive. Now the tables of critical appraisal of the antibiotics, I use the relative risk and relative risk reduction calculations to try to find out which of these interventions were better, and this is what I found out. I did the calculations, as you can see right here. And of all the calculations that are done, the table C, table 1C showed a 1%, 4% difference. Yeah, the bacterial infection may be reduced by 4% more in the treatment group than in the control group on the table 1C. But 4% is not that much of a difference. So I think that both treatments were basically equal more or less in response. The validity of both studies. Critical appraisal revealed that the clinical trials were properly conducted and that all the critical points were properly addressed. All of the questions were answered positively, except for the one where it was could not be blinded. When people who have pneumonia, it's quite obvious. The Petri scales also did not find any fault with the disaster studies, and the results were interpretation of the results. The outcomes were favorable. The alpha level of probability was estimated to be 5%, p-value 0.05, which is statistically significant and not likely to be due to chance. And the CI scores were also provided. I used several references. By conclusion, critical appraisal identifies evidence-based interventions and also cost-effective smoking cessation programs for patients. Respiratory infections and HIV/AIDS are poverty-related, communicable diseases with high mortality, according to the World Health Organization. The risk of morbidity and mortality need to be reduced. Patients need to maintain an optimal quality of life in spite of opportunistic diseases. More critical appraisals are needed to identify safe, effective, and affordable interventions for poverty-stricken and unemployed patients. Economically disadvantaged deserve better than watered down HIV or AIDS drugs. Thank you very much.